Hello again, everybody. For those of you who are not aware, my name is Tanner LeBoyne from the Schizophrenia Society of New Brunswick. Today, we're going to be talking about psychosis. So what exactly is psychosis? Psychosis can be best defined as a separation from reality. Somebody in psychosis is not experiencing the same reality we are. Psychosis is a condition that affects the mind, resulting in the person being unable to tell the difference between what is real and what is not real. So what are some of the symptoms of psychosis? We can break down the symptoms of psychosis into two major categories: positive symptoms and negative symptoms. Positive symptoms are not things that are good. Positive symptoms are things that are added to the individual's personality as a result of the illness or things that they have an excess of. Negative symptoms, on the other hand, are things that are taken away from the person's personality because of the illness or things that they do not have enough of. Let's go over some of them. So the positive symptoms. Let's begin with hallucinations. A hallucination is essentially a false experience. As human beings, we have five senses: hearing, seeing, tasting, feeling, and smelling. We can experience a hallucination in any of the five senses. We can have them in one, or all, or even anywhere in between. The most common form of hallucinations are auditory hallucinations, which is hearing something that is not really there, often in the form of voices. These voices are generally very degrading, negative, insulting, and even comment on behavior. Delusions. A delusion is a strongly held false belief. The individual will not deviate from their belief despite being presented with contradicting evidence. Disorganized thinking and speech. When someone is in psychosis, they will often jump from one topic to another topic without any clear logical connection. This disorganization can also manifest itself in behavior. And somatic concerns, which are concerns about the body. So the negative symptoms. Poverty of thought. Poverty of thought refers to when the individual has difficulty processing or vocalizing thoughts. Social isolation. Poor hygiene. Poor performance in work or school. And flat or inappropriate affect. Flat affect refers to when the individual has an inability to express their emotions. Inappropriate affect, on the other hand, refers to when the individual experiences inappropriate emotional responses, such as laughing at somebody's death or crying while watching a comedy. These are some of the negative symptoms associated with psychosis. Other important symptoms include anxiety, depression, and deterioration of cognitive functioning and thought process. So what exactly causes psychosis? Like most disorders, there is no one specific cause of psychosis. In most cases, psychosis is caused by a combination of biological and environmental factors. Let's go over some of the biological factors that contribute to developing psychosis. A genetic predisposition, which is a family history, so somebody in your family who has had psychosis. Excess dopamine. Dopamine is thought to be the main neurotransmitter involved in psychosis. Prenatal complications. An overactive immune system. Viruses. And abnormalities in brain structure. These are some of the biological factors that can contribute to developing psychosis. Now let's go over some of the environmental factors. Excessive substance use. Most people don't realize that cannabis is actually one of the most common triggers for psychosis. So do not be fooled. Legal does not necessarily mean safe. Excessive cannabis use can certainly be a precursor to a psychotic episode. Extreme stress. Lack of positive coping mechanisms. An unstable living environment, and traumatic events. These are some of the environmental factors involved in psychosis. So there are many different forms of psychosis. Let's talk about some of them. Schizophrenia. Schizophrenia is a disorder in which you have had symptoms of psychosis that have exceeded 6 months. Schizophreniform disorder. Schizophreniform disorder is a disorder in which you have had symptoms of psychosis that have lasted less than 6 months. Schizoaffective disorder. Schizoaffective disorder is a disorder in which you have had symptoms of schizophrenia comorbid with a mood disorder. Bipolar disorder. Bipolar disorder is a mood disorder. There are actually 5 different types of bipolar disorder. Typically, only bipolar 1 has psychotic features. Clinical depression. In some severe cases of depression, the individual can have psychotic symptoms such as delusions and hallucinations. Brief reactive psychosis. This is a form of psychosis that occurs after you've had a traumatic life event, such as the death of a close family member. Typically, brief reactive psychosis will not last longer than a month. Organic psychosis. Organic psychosis refers to when some physical illness triggered psychosis, such as dementia or a brain tumor, and drug-induced psychosis. Certain drugs such as cannabis, LSD, and amphetamines can trigger symptoms of psychosis. So how exactly is psychosis treated? Psychosis is often treated with medications known as antipsychotics. There are 2 different types of antipsychotic medications: first generations, known as typicals, and second generations, known as atypicals. Antipsychotics work by blocking the receptors of certain neurotransmitters, specifically dopamine. Dopamine is the main neurotransmitter that antipsychotics work on. Depending on the illness at hand, other forms of medications may also be used to treat psychosis, such as mood stabilizers, antidepressants, and anti-anxiety medication. Some other forms of treatment that may be used include cognitive behavioral therapy, psychotherapy, and group therapy. These are often used in conjunction with medication. So I would like to thank you all for taking the time to watch this video today. I hope it was very helpful and informative. For your benefit, in the description I have included some contact information if you are looking for help. Please remember, however, if you are in crisis, call 911 or proceed to your nearest emergency department as soon as possible. I have also included links to various websites if you're looking for more information about these topics. Thank you everybody, and remember, recovery is expected.